Under Mayor's announcements, in the last week, Grand Forks has joined communities across the nation in an effort to slow the spread of coronavirus. We hope our collective precautionary measures will promote the safety of residents and our community as a whole. We're focused on the health of our employees and the continuity of service, including our public safety and public works crews charged with uninterrupted service, even in challenging times like these. Last night, Governor Burgum announced the closure of all K-12 schools in the state for this week to mitigate the spread of COVID-19 throughout North Dakota. I fully support the governor and his decisions to close schools this week. These pressing times call for strategic action. I'm happy to see the proactive approach to this public health situation. This morning and this afternoon, I held department head meetings where staff provided updates on their mitigation efforts and the proactive steps we are taking to ensure essential city services and functions continue. We're looking to transition into a virtual City Hall. City Hall will remain open to the public at this time, but we strongly encourage all citizens to utilize the city's website to get permits and to pay utility bills when they're at all possible online. I also encourage citizens to interact with city staff over the phone or email when able. We're doing our best to reduce foot traffic and ask everyone to be flexible as we adapt to these changing circumstances. And there's a lot of information and misinformation surrounding COVID-19. I encourage citizens to seek out trusted and validated sources of information. We will look to provide regular updates on what the city and state are doing to mitigate the spread of COVID-19 in Grand Forks and in North Dakota. City staff has set up a webpage, grandforksgov.com, with links to trusted resources like the CDC, Grand Forks Health Department, and the North Dakota Department of Health. The best thing for everyone to do at this point is to stay informed, practice social distancing, wash their hands frequently, practice good personal hygiene, sanitize frequently used surfaces, and stay at home when at all possible. Additionally, I'm recommending no gatherings larger than 50 people occur within the city until further notice in accordance with CDC guidelines. Grand Forks Public Schools recently announced they'll provide grab-to-go meals for school-aged children on regularly scheduled school days, and that's a great service and evidence of a proactive and diligent approach to these extraordinary circumstances. We understand this is a difficult time for our local businesses. Even in these difficult times, local businesses have stepped up by offering free and reduced meals for children. They're looking out for our community members in need, and one of the many reasons which makes this place so special. We've been in contact with the district SBA office, Department of Commerce, and the governor's office. The SBA's Office of Disaster Assistance is coordinating with the state's governor to submit the request for economic injury disaster loan declaration. The governor needs to receive 5 or more company worksheets as soon as possible. This will qualify the state for economic injury disaster loan assistance. Once Governor Burgum requests and SBA approves the declaration for North Dakota, businesses will be able to go to submit the actual loan application. I encourage businesses to go out to our website and follow the steps to complete the worksheet, which will help unlock the funds. As we get more information from the SBA and the state, we'll disseminate and communicate that information. We understand these mitigation efforts will have an economic impact on our small businesses and the workforce in our community. We have a unique opportunity in Grand Forks to mitigate the impact of COVID-19 to our community through proactive steps taken now. I'm looking to encourage council members, city staff, and partnering organizations in the implementation of mitigation strategies and stress that we do so in a calm, proactive approach where public health and public safety are the 2 highest priorities. I want to assure everyone that we have effective teams in place, from City Council leaders, State Administrator Todd Phelan, Public Health Director Debbie Swanson, City Department heads, and our partnering organizations in town. We have prepared an experienced group of professionals to guide us through these times, and the city has taken a variety of steps to accommodate citizens during this unique period, while also applying best practices to mitigate COVID-19 and its spread in our standard operations and procedures. In addition, we have updates on the Flood Action Plan and Census 2020 efforts tonight. There's a lot going on, but the city is making sure it executes its mission to protect and serve. So now I'll look to Mr. Phelan and others to provide the information before us. So item 2, awards, presentations, appointments, and proclamations. 2.0.
Coronavirus update.
Mr. Phelan, welcome.
Mayor Brown, members of the City Council, Debbie Swanson is going to lead us out with the update, and obviously Public Health has been the lead agency on this COVID-19. Tangi Bovetta is going to talk about some of our workforce opportunities that we've been working through and some of our challenges. Maureen's going to provide an update on our financial picture and to include with some of our strategic partners. And then we're really glad that we have representatives from Ultra here tonight. So Dr. Bowe and and Megan Compton from Alter are going to provide an update regarding the Alter Health System. Tom Ford's here on behalf of the county if we have any questions, and we've also been in discussions with Terry Brenner too. So if there's some questions on school, we'll have some general understanding. Then I think once we're all through that, if there's some general questions on what we're doing, we're trying to push out as much information as we can among all the different departments. But after that, we can certainly take some Q&A after that. So I'd welcome Debbie Swanson to the stage.
Good evening, Mayor Brown and members of the City Council. I'm Debbie Swanson, Director of Grand Forks Public Health Department. And Mayor Brown, I have to thank you for your comments because you've said everything that we would say as a public health department in terms of how much we care about this community and want this community to be safe and healthy. I have a really brief update for you on some of the activities of Grand Forks Public Health Department. This is our situation report, which will go out this evening yet. It's the latest information from the World Health Organization, the CDC, and probably most important, the information from the North Dakota Department of Health. As of Monday, there is still just one confirmed case. There are currently 22 people being monitored because of travel situations out of a total of 20 monitored thus far. A total of 124 people have been tested, and 0 people have been hospitalized and 0 deaths. So that's the good news. You can see on the right side of the screen there all the public health efforts, largely coordinating with our partners at the North Dakota Department of Health. An unexpected task that we have been given is transporting specimens, getting them to Bismarck so they could be tested at the public health lab. So that has taken up a tremendous amount of our time, but we expect that our courier service will pick up and do more of that transporting now in the future. We're doing a lot of prevention messaging with our stakeholders. Something that you may not be aware of is we have a state cache with supplies, unlike other states. We have been stockpiling supplies for events like this. So it includes things like personal protective equipment, masks, gloves, ventilators, things that would be needed to help supply our healthcare organizations. We're doing a lot of work with our colleagues across the state in public health, and then assisting our partners. Altru is here, and I'm sure they'll tell you a little bit about the work that they've been doing since January as well, and we're very grateful for all of their response activities. We have a crisis communication team within the Grand Forks Public Health Department, so we're including information on our Facebook page, our website, various places, and then we'll be doing situation reports 3 times a week. We have attended numerous meetings, and this morning we convened all of the public schools and private schools in Grand Forks County, and then we had colleagues from East Grand Forks attend as well, and it was a really great update for all the schools to come together. They just only found out in North Dakota last evening that they would be closing without very much warning, and they were at the meeting this morning with plans in place and telling us a lot about the things that they will be doing, so we're very happy about that. Another activity that we had as a health department was a repatriation effort of some residents that had been on an overseas cruise and came back to North Dakota, and we were able to meet them and start their quarantine period here. And then a lot of agency coordination and communication. And just when you think everything is let's see if I can pull this. The site doesn't want to come up on a hyperlink for me, but I will show you the 2 websites from North Dakota. This is the Minnesota Department of Health, and this is their update, and they did have a large number of cases increase today. I believe they received another 19 or so positive tests out of 1,893 that have been tested. And then North Dakota has a really nice dashboard with the same information that I had in our situation report, but they have a great deal of information on this website for businesses, for childcare, for schools, for healthcare providers. Everyone, I would strongly encourage you to look at it. So those are just a couple of the statuses of Minnesota and North Dakota. And then I wanted to mention that we have hotlines set up. The North Dakota Department of Health has a hotline. This is for general questions from the general public. They're 777, so they have a lot of hours that they're available to answer questions. And then the Operations Center number is listed there for you also. AllTrue set up a hotline, and the purpose of this hotline is to triage patients so that people who have symptoms or who have had travel history and now have symptoms can contact the hotline and be screened by a nurse prior to coming in. That protects the healthcare workers and makes sure that we're testing the right people. So this hotline isn't for general information, but for patients who might have questions. This is what we are trying to prevent through our social distancing. So if we put no social distancing measures into place, we would have that tall yellow spike that you see there on the screen. This would concern us a great deal. It would overwhelm our healthcare systems. So we call this the flattening of the curve. What we want, we know we will have cases. We know that people will become ill in our community. But what we would like to have is that longer, flatter curve where they present over time and not in a huge spike that would require a lot of resources. So if it feels like we're being aggressive by closing schools, by making recommendations for businesses, by closing events, it's to flatten this curve and make sure that when all of us get sick or if we get sick, we have the healthcare resources available. We know there's surge capacity, but not for a huge number of cases all at one time. We have a lot of history of how that works from past pandemics, most specifically from the 1918 Spanish flu pandemic. Social distancing includes some things like the North Dakota and Minnesota K through 12 schools closed. North Dakota today and Minnesota will be closed on Wednesday. And then this is fairly new. The CDC recommends that for the next 8 weeks that organizers cancel or postpone in-person events that consist of 50 or more people. And that's throughout the U.S. So we're starting to see the effects of that everywhere, and I'm sure many of you are starting to see those cancellations as well. And there is a link on this presentation with further information for those mass gatherings. Lastly, I just want to talk a little bit about our communication activities that I have alluded to thus far. As I mentioned, we have a crisis communication team. We meet fairly regularly. We're doing a lot of social media, both on Facebook and Twitter. Grand Forks Public Health Department also has a website where a lot of information is available, and then there's a link on the city website, which the mayor alluded to earlier. We've also been doing quite a few media interviews, so I expect that more will follow in the weeks to come, and I'm certainly available to answer any questions now or anytime.
Thank you very much. Any questions? Any comments? I see our social distancing here. Ms. Mock?
My mic isn't working. Debbie, what are the common symptoms, and are they still recommending that you call before just going into the hospital? Is that practice right now is to call a hotline and ask?
Yes, sure. Councilmember Mock and members of the council, Mayor Brown, we do recommend that people call before presenting, primarily so that we know how severe the symptoms are. They're typically a cough, a fever. A fever seems to be somewhat universal. There's a range of symptoms. It can range from a shortness of breath seems to be fairly common in a lot of patients as well. The reason for calling is not to keep people from being tested, but to make sure that we have tests for people who really need it. We expect we'll be doing a lot more testing as it becomes available. Also, I wanted to mention that healthcare providers can use their discretion to order testing now. They previously had to call the health department before doing it, but now they can recommend testing on their own clinical judgment.
Thank you. Any further comments? Mr. Weber? Ms. Marshall? And then some of the mics aren't working up here. Well, mine does. There's a reason for that. So, Cheryl, can we work on the mics? Okay, and then
I can repeat the question.
to speak
too.
loudly.
Mayor, if you could repeat the question. If you could repeat the question.
Okay, is there a question? Then I'll repeat it.
Yeah, I'm wondering about the availability of test kits and where we stand with potential shortages in test kits.
So the question about availability of test kits and possible shortages.
Yes, we know that test kits are fairly limited in our state and across the nation. That was due to some decisions that have been made along the way as this incident has unfolded. However, the news is good in that they expect to ramp those up pretty quickly in the next several weeks. There are daily updates on testing availability and the science around this virus, keeping in mind that this virus has only been known to us for about 90 days. So the fact that we've identified it, we've done sequencing, genotyping, and can do PCR testing on it is pretty phenomenal for something that's only been around for 90 days. So we would expect some delay, but we know that it's going to be increasing quite a bit as we get more test kits available. I do not know the status of where testing will be available elsewhere in the state beyond the state health department, but there are many, many providers that can collect the sample. So we don't have any problems with collecting the sample. It's the numbers that can be run.
Thank you.
And the same would be true for vaccine. We expect about at least a year before we'll have a vaccine available. It's a coronavirus that's novel, so that will take much more time to develop, unlike flu vaccines, which we know more about.
Thank you.